Rebecca read that PHGG, like Healthy Origin Sun Fiber, has improved SIBO success rate when taken with rifaximin and also helps with constipation. Would it also be effective if I'm already now on day 4 of rifaximin for hydrogen SIBO?
Yes, you can absolutely add it in.
And would I stop partially hydrolyzed guar gum when rifaximin is stopped, or can continue after treatment?
You can continue after.
What side effects have you noticed that would make someone then discontinue it?
So the side effects are the symptoms of SIBO, worse bloating, worse constipation, or worse diarrhea, nausea, acid reflux. Mainly, I'd say it's bloating and the bowel movement changes, and that is related to any fiber that anyone would try taking. It's fabulous that we have these studies. I don't know if you've seen it, but it also has been shown to reduce methane gas in studies. So we kind of call it like a SIBO safe fiber, but we really shouldn't, because it's for each individual to figure out if it's safe for them, and safe meaning, does it make their symptoms worse? So the recommendation always when starting any fiber, including partially hydrolyzed guar gum, is to start lower than the recommended dose. The dose used in the study with rifaximin was 5 grams, and most of the bottles you buy of it, it comes as with a scoop that's 5 grams. And so I would say start, with either a fourth or a third of a scoop for the first day or two. I know you're already on, day 4 of rifaximin, so you're probably wanting to get right up to full dose, but so this will be up to you to decide. But starting it slow and ramping up can allow it so we don't get those symptoms, and we can slowly adapt, and we can more easily see if we're starting to get them.
Okay, and then what's the best time of day to take the PHGG?
Well, I don't think that really matters.
Okay, and can we use PHGG for IMO as a fiber?
Absolutely, since it reduces methane gas.
Okay, and Dr. Pimentel does not advocate for any kind of fiber, not even PHGG. Why is that?
Because it's direct food for bacteria. I mean, fiber's prebiotic. What this is all about is that humans don't have the enzymes, the digestive enzymes, to break fiber apart to digest fiber. So but bacteria do. And so fiber, including PHGG, is direct food for bacteria. It's a high FODMAP. If you want to think of it that way, it's a high fermentable food. So, he doesn't want to feed them anything more, but then we have these studies, like the study that was done with rifaximin. It had higher efficacy when used that way, and brings down methane gas. So, this is our interesting, challenging, complex world we live in. And so what do? We try things on ourselves, yourself, and see, does it work for you?